Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Anisa Safia binti Ahmad MUSHIR. My metric number is 1200150. Today we are going to present about attention deficit hyperactive disorder, or we call it as ADHD. Firstly, I want to introduce our psychiatrist that we have interviewed a few weeks ago. His name is Dr. Muhammad Hafiz bin Osman and he born at Kuala Lumpur. He studied at University Malaysia Sarawak UNIMAS during his degree period and pursued his study in psychiatrist course at University Kebangsaan Malaysia UKM. And now he is working at Hospital Port Dickson as a psychiatrist officer.
Assalamualaikum, and my name is IZZATUL. I will now continue with the causes of ADHD. There are several of things that can cause ADHD, and that is genes and hereditary. ADHD frequently runs in the families. A child with ADHD has a 1 in 4 chance of having a parent with ADHD. It is also likely that another close family member, such as a sibling, will also have ADHD. Sometimes, ADHD is diagnosed in a parent at the same time it is diagnosed in the child. Second, significant head injuries. It can or may cause ADHD in some cases. Third, prematurity. Prematurity can increase the risk of developing ADHD. Fourth, prenatal exposures, such as alcohol or nicotine from smoking, can increase the risk of developing ADHD. And lastly, toxin in the environment. It can or may lead to ADHD. For instance, lead in the body can affect child development and behavior. Next, I will continue with the symptoms of ADHD in kids and adults. So there are two types of behavioral problems in kids. Firstly is inattentiveness, and the second is hyperactivity and impulsiveness. So for the inattentiveness, the main signs are the children is having a short attention span and being easily distracted. They can also making careless mistake. For example, in schoolwork, they will be appear forgetful or losing things. They will also be unable to stick to tasks that are tedious or time consuming. They appear to be unable to listen to or carry out instruction. They will also constantly changing activity or tasks, and lastly, they will have difficulty organizing tasks. So for the hyperactivity and impulsiveness, the main signs are they are being unable to sit still, especially in calm or quiet surroundings. Next, they are constantly fidgeting, whether their fingers or their clothes. Next, they are being unable to concentrate on tasks. They will have excessive physical movement and excessive talking. They are being unable to wait their turn, acting without thinking, and lastly, they will always try to interrupt conversation. Different cases for adults that have ADHD. ADHD symptoms in adults are more difficult to define. This is primarily due to the scarcity of research on adults with ADHD. Because ADHD is a developmental disorder, it is thought that it cannot develop in adults unless it first appears in childhood. However, symptoms of ADHD in children and teenagers are frequently persist into adulthood. In attention, hyperactivity and impulsiveness can affect adults in very different ways. Adults, for example, tend to lose hyperactivity while retraining in attentiveness as the pressures of adult life increase. Adult ADHD symptoms are also far more subtle than childhood symptoms.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is ERNY SYAZWINA. My matrix number is 1202753. So today I'm going to present to you guys regarding to the effect of ADHD. So firstly, the effect that we can have a look on ADHD patients is low self-esteem, depression, anxiety, conduct disorder, and social isolation. For example, if some people have been diagnosed with ADHD, they might be have low self-esteem, such as they might be thinking that nobody loves them, nobody want to talk to them, nobody want to work with them and whatsoever. So it can cause a lot of problem. It can cause a lot of effect after it's influenced one by one. Okay, so next is substance abuse, antisocial, and personality disorder. Why did all this might be affect them? Because they might be thinking that I just want to be with myself. I just want to have me. I just want to be alone, and it's all becomes to have them loneliness. So with all this substance abuse and social might make them more depression, might make them more tend to have any other of mental illness. So we have to help them to get better in their life. So next, decreased scholastic and job performance, and inability to form lasting bonds with others, and also dropping out of school. Most probably, all these three effects might be effect with children. Might be we can look at the effect on the children, which is in primary school and also secondary school. So all these might affect primary school, the children, because the children might be thinking that there's a lot of things happen to them, such as temper, tantrum, and whatsoever. Meanwhile, low self-esteem, depression, anxiety, conduct disorder, and so on might be happen to the adult. So when we look at a patient who have ADHD, we can't say that it affect themselves until they become adult. So we as a counselor play a good role model to help them from being uh, um, for face this ADHD, this illness, for a long lasting. So what we can do as a counselor, we have to help them and to get them a better life. So with all this effect, might be think or might be help with a good condition, with a good treatment for them. So as a counselor, we have to think that all this effect can be prevented, or this illness can be prevented with all the treatment that we can do for to help them. So so please get rid of this effect. Please focus on people who have ADHD so that we can help them and prevent them from become worse.
For the ADHD patient, it is not impossible for them to comorbid with a few diseases. Firstly, they tend to have intellectual learning disability because they are not able to focus in the class and start to feel bored with the study environment. Other than that, they also can have conduct disorder. They can burn and damaging items, and this kind of disease is dangerous to the other people. Lastly, ADHD patients also tend to have depression and antisocial personality disorder.
What if our children or family member diagnosed with ADHD? If they are diagnosed with ADHD, they will seek for treatment and therapy. For patients who are having mild ADHD, they will receive occupational therapy treatment, family intervention, and psychosocial therapy. However, for the patients who are having moderate to severe ADHD, they need some medication, and this really help them to cope with this disease. For example, amphetamine will help them to control themselves. In addition, important for parents and family ask them to go out and exercise to give them opportunity to run, to get active, so that they will be free and released.
For the conclusion about ADHD, to get a formal diagnosis, no single test can confirm whether you have ADHD or not. Psychiatrists and psychologists will get information based on what and how many symptoms you have. When these symptoms start, how ADHD has a big impact in your life and how severe or level your symptoms are. Discussed above, the meaning of ADHD is attention deficit hyperactivity disorder, and it is a disorder in the development of the mind and facing problem of attention deficit hyperactivity, decision making without thinking about the consequence, and management problems. Patients diagnosed with ADHD also have dyslexia as well. They also experience difficulties in daily life and need help of others. How to overcome if our patient have the ADHD is they will get some treatment. Also, the parents and families are important too, can because they can invite them to do activity that can be fun and lighten their load.